Hello, thanks for joining me today. Today we're going to cover the start of care packet for the paraprofessional side. We will select a patient. If you were told to open a patient today, we will put the patient's name in here. We will do our COVID screen during COVID time, obviously, before we go to the patient's home. We should also have the information on intake. Remember, the intake diagnosis is the primary diagnosis in our chart. Let's open up our start of care packet. We must get our home health consent first. Let's cover our home health consent. It has several sections. The main section of the home health consent covers care and treatment by any and all ACHC designated personnel. The release from information are all required aspects, especially pertaining to the Department of Health. We have our patient bill of rights. We have the right to be fair and kind to the patient as well as the patient to us. The notice of privacy practices, all of the information is kept private. Emergency preparedness info, basic home safety info, home care bill of rights, our first step of advanced directives. Complaints. Does the patient have any complaints? Do we have any complaints? If there are problems, the patient can complain to us. The patient can complain to a supervisor. And of course, the patient can complain to the Department of Health. We always inform them that their documentation and information is protected by privacy rights and will be kept private at all times. Consent for photography. The patient is required to sign a consent for photography so that they can always be prepared in the event of an issue. We can have photos sent to their doctor for care that may be needed on a quick basis. Permission to release information. This section is vitally important because we always have to send documentation to insurers and insurance companies for care and treatment and of course reimbursement. In this section, if you note that they direct care and information to the following persons. So here we can add others. We can add spouses, children, neighbors, loved ones, anybody on their healthcare proxy. The assignment of insurance benefits, of course, is for payment to us. We do not do Medicare, so these two should never be filled in. Medicaid can be 100%. It could be commercial insurance, or it could be both. It could be age well and private pay. Here, that could be the financial responsibility indicated to us. We would fill in skilled nursing or PCA or HHA, dependent on what was ordered. The consent here by the patient, and the patient's name goes here, is an advisement to them that we are asking them if it is okay for the Department of Health or any accrediting agency to come to their home during a visit. You, the nurse, are the witness. I'm so sorry. Your name, after typed in several times, will be an automatic fill-in, as mine is. You would select today's date, and you would have the patient sign it, and of course accept the signature. The next step, as we always go back to home, the next step is within our start of care packet. We would review our emergency Cardex form. Is the patient a green, which is low priority? Are they yellow, a moderate priority, or red, a high priority? Who is the primary nurse that will cover this patient? In this section, as the aides can always change, we don't necessarily want to put the aide's name in, but we can put in her name or the PCA designation, and we could put in 7 hours for 5 days. Once the Cardex is created the first time, it will auto-populate every other time we visit the home. This is now our third step to determine if this patient has advanced directives. We must educate them to do due diligence for themselves to create something or have something in place. We will sign it, we will have the patient sign it, and we will print it out. We will save this form. We will go into our adult assessment. Our adult assessment is important to remember the first few aspects of our time slip. Your evaluation code will either be a drop-down or will be a designation that you will be educated with. Your event code and your service type, which for your case is a skilled nurse, are important to always have in your time slip as they go to billing for payment and reimbursement to the payer. Without those two fields filled in, there could be delay in both. You will set your time of the visit. The signature is only to be done and accepted at the end of the visit. You will go through prompts as required. Every gray box, every single gray box is an important element to be filled in, as this will go to be created for your plan of care. Once you pick something, you will hit Insert to Form. If you notice, it went into the gray area. We have now our third advance directive that we are reviewing with the family or patient and or both. Should we have educated them several times, we will pick Insert from Template, and the best option here would be Not Available but Family Educated. We will select that drop down and Insert to Form. Please make sure that you review with them their doctor. Their doctor must be somebody they are seeing and have seen within the last year, as they are the ones who will be signing the doctor's orders. When was the last time they saw the doctor? When was the last time they contacted the doctor? And for what reason? Every radio button must be filled in. If the radio buttons are left empty, the form will not be able to be allowed to submit to office. For example, if I hit Send to Office now, I know this form is not complete. It will give me an error to tell me exactly where all the problems are. As we haven't reviewed most of it is not filled in. You will become a pro. Do not worry, it will go fast. After a couple of them, you will realize how quickly you will be able to get this done. Prior hospitalizations are important to ask of these patients. Here we have another gray box. What could our safety measure be? A lot of these patients will have a 911 protocol, clear pathways, emergency plan, equipment safety, potentially fall precautions, medication safety, safety in ADLs. Remember, you're the ones in the home evaluating the patient. Our second page is our diagnosis page. Remember, we said we must look at the intake form. The intake form will advise us of what the primary diagnosis for this patient will be. The primary diagnosis must be in this section. For sake of time, let's select all of our diagnoses, Insert to Form, and we move along. Please always make sure our primary caregiver is indicated in this section. Most likely this is our emergency contact. We go through our prompts, we start going through our body systems, functional limitations. Of course, you're assessing the patient, so whatever you deem necessary for this patient, for their orders, are what you can put in here. We move along and we continue in the same stead from page to page. Please make sure all of your notes are going from top to bottom and left to right. Make sure you do the timed and go test upon entry into the home. Your timed and go, trial 1 would be when they answer the door to the time they sit down. Trial 2 could be when they leave or go to the bathroom mid-visit, and that's your average.
We must do the Braden scale to monitor their risk for skin breakdown. Our integumentary section is very important, especially to monitor for any wounds or lesions upon initial start of care. We continue our body systems. Make sure that we add all gray boxes for the plan of care. If we do a PHQ-2, remember a score of 3 or greater requires us to do a PHQ-9, which is found in our forms section. Should we have any grave concern, we call the doctor. The doctor can be found on the left side of the chart in SPOC, in the patient's chart. Again, we review the homebound status. It is imperative to go through every single one of these lines in detail. Remember, if it's a 5 or more, they are at high risk, and homebound must be indicated on the care plan. Again, we review all materials within our pamphlet, our rights and responsibilities, advanced directives. This is now the 4th time we must review it. Medication information, HIPAA, everything that's listed here minus OASIS. We do not fill in OASIS. We go through our DMEs. Again, the red, we can highlight it to click to open, to insert from template, to go into our categories, to pick anything that we need. We insert template to DME. We go insert to form, and it winds up in our box. We go to the last section of our start of care. Within this section, we find our eligibility. Palliative care is not needed. Homebound status definitely would be something to be chosen from very selectively, especially if from the previous page the patient is a 5 or greater. Many of these patients do require transportation help. They might have mental deficits. Remember, if anything looks like this, describe. We want to clear that out from our order, or has a condition to leave with assistance from a spouse, anything to that effect. Our interventions are going to be pertinent to the patient. We, of course, want to fill in hours. You would always go to insert from template when you are creating a new chart. It will give you various drop downs and all of the various comorbidities for this patient. For sake of time, we'll go through the examples that are already present. We can pick hours here. The nurse will see this patient. The aide will see this patient 7 hours, 5 days a week. And here we can add a row for nursing, skilled nursing, every 6 months, and PRN. The patient indicated a heart condition, so we want to inform them to check their weight daily. They have diabetes maybe. We want to encourage them to check their feet and have the aide possibly help them. They indicated a lot of pain, so we want them to use various methods for their pain. There's one important element that we also want to look at. We want to look at our HHA section, as most of these patients have aides for care. So, what is the primary purpose of the aide in the home, where they're going to assist and do some light housekeeping? They're going to help with transfer, and we're going to indicate that the care plan was reviewed with verbal understanding. So we can add that in. Now we can change this because we have blanks in here. Aide will carry out transfers and ambulation using assistive device